Aloha. Coming from our nation's capital in Washington, D.C., I want to welcome you to my show, Conversations with Kai, where every month I sit down with national elected leaders and subject matter experts to discuss issues important to Hawaii and our nation. Medicare for all. You've probably heard of it, but what exactly does it mean, and how can it fix our nation's broken healthcare system? Today, I want to tackle that question and talk about our progressive vision for universal healthcare in the United States. And who else better to join me in this discussion than Congresswoman Pramila Jayapal, who is the lead sponsor of Medicare for All legislation in the U.S. House of Representatives. Congresswoman Jayapal represents Washington State's 7th Congressional District and is the chair of the Congressional Progressive Caucus, the largest ideological caucus in the Democratic Party and one I am proud to be part of. Congresswoman, thank you so much for joining my show. The people of Hawaii are honored that you are here today, and why don't you take a moment to introduce yourself and discuss some of the key priorities of the Progressive Caucus.
Well, thank you, first of all, for having me on. And let me just say, Hawaii is so lucky to have you representing.
Mahalo.
It has been an honor to work with you, and you've already made such a difference here in Congress. And of course, to have you in the Progressive Caucus is fantastic. So, as the chair of the Progressive Caucus, we are really looking at what is the vision of the United States that allows people to wake up in the morning where every person feels like they have a shot. They have a shot at opportunity. They have a shot at a decent job that's going to allow them to put food on the table, to raise their kids with dignity, to retire with dignity, and of course to have a roof over their heads. So that's a lot of what the Progressive Caucus stands for. And of course we take at the center of all of that racial equity, recognizing relationships with tribal governments, making sure that everyone feels represented. Now in the Progressive Caucus, we have 96 members, and so we are very strong. We have a lot of efforts that we're driving right now, particularly around the American Jobs and Families Plan, our progressive priorities that we've identified, which is the care economy, making sure people have child care, paid leave, access to long-term care coming out of the pandemic. That's one of our top priorities. So is housing, making sure we've got affordable housing across.
Universal preschool.
Universal preschool. I mean,
free community college.
That's right. Free. I mean, all the things that you and I ran on.
Yes.
Are the things that are contained, at least in the initial framework that we are fighting for. So I'm incredibly excited to be chairing the Progressive Caucus. I, of course, also am an immigrant from India. I came here when I was 16 years old by myself with nothing in my pockets. My parents took the risk of sending me across the ocean with the last of their savings because they believed America was a place where I could thrive and survive. And so I work on a lot of issues related to immigration as well, and I hope in this next package we also get a path to citizenship for our essential workers, for our dreamers, farm workers, TPS holders. That's another big priority. So life is full and packed here, as you know, and a lot of the work centers around healthcare. So I'm thrilled to be here to talk about Medicare for All.
Well, we're so lucky to have you and your leadership in the Progressive Caucus, and it's great to serve with you. 56 years ago, almost to the day. It will be this upcoming Friday.
Yep.
President Lyndon B. Johnson signed into law landmark legislation that established the Medicare and Medicaid programs. Now, over the years, these programs have protected the health and well-being of millions of Americans and saved lives and improved the economic security of our nation. Though Medicare and Medicaid started as basic insurance programs for Americans who didn't have health insurance, they've changed over the years to provide more and more Americans with access to quality and affordable health care they need. We've made improvements with the Affordable Care Act to ensure millions more Americans are covered, but so many throughout our country still don't have access to health insurance, which has become glaringly obvious during the COVID-19 global health pandemic. Health insurance companies have taken advantage of consumers, denying necessary care while making record-breaking profits. COVID-19 has shown a spotlight on our broken for-profit healthcare system, and Americans go unmatched in paying the most per capita for healthcare than any other country in the world. Yet nearly half of all adults under the age of 65 are reported as uninsured or underinsured. How can this be? Congressman, can you explain what brought us to this state in our country today?
Yes, and I think that you've outlined the basic facts of the situation, which is that the United States is the only peer country among industrialized nations that does not consider healthcare as a right for people, that it isn't universally provided by a government system. Now, some countries have differences and a little bit that's provided by other sectors, but there's a fundamental concept that you cannot achieve anything else if you don't have your health. In the United States, we unfortunately started with a patchwork of ways to provide health insurance for people. Getting Medicare through, and we're going to celebrate the anniversary, was not easy. I mean, people called it socialist. They called all of the presidents, going back to Teddy Roosevelt, actually, socialists for proposing a Medicare for all system. And when we finally got Medicare through, it was only for people over the age of 65. And so for everybody else, what we have done is rely on a for-profit private insurance system. And that means that most Americans have to buy their health insurance through a private insurance company that raises the price of that insurance, that controls the choices that you have. You know, people say, oh, some people that fight Medicare for all, which would essentially be a system where the government provides your insurance. You would still go to the same doctors, the same hospitals, all of that. But your insurance card would be from the government, and we could, in that way, actually control the costs and ensure that you get the care you need whenever you need it. You're not tied to one employer. You actually are able to change jobs. If you want to start a small business, you can do that, and you know your health care is not going to go away. The system that we have now prioritizes for-profit insurance companies, pharmaceutical companies, and it is at the cost of Americans who desperately need care. So what you said about how we spend the most, some people think it's more efficient, to do it through the private insurance system. Absolutely false. We spend the most and we get the worst results. We have the highest maternal mortality of all of our peer nations. We have the lowest life expectancy, just went down again with COVID, of course, of all of our peer nations, and we pay the most. It is unsustainable from a budgetary standpoint. And when you think about it, if you're a consumer, you're worrying about copays, you're worrying about deductibles, you're worrying about out-of-pocket costs, and at the end of the day, you are paying an enormous amount of money that most people can't afford. And that's why 87 million people in the United States, even before COVID hit, were either uninsured or underinsured. And now after COVID, we know that there's tens of millions more who are in that situation because we tie healthcare to jobs. Only country in the world that does that. So you lose your job when we have the lowest employment because of COVID, you lose your health care. That is just unfair. And so our Medicare for All system says, or proposal says, no, we don't need to do that. We can be like other countries. We can guarantee health care as a human right. The government can provide the insurance just like we do for people over 65, just like we do for veterans and for people in the military that use the TRICARE system or the VA system. We know how to do this. It is way more cost effective, and we ensure that everyone gets the health care they need.
You talked about peer nations and other industrialized countries. What best examples of other countries that the U.S. is at peer-to-peer level with have the type of healthcare program that Medicare for All would to achieve?
It's such a great question. And we in the Medicare for All caucus in Congress that I started, we have these discussions where we invite people in from other countries. So I would say some of the countries we've really been looking at are Canada, Australia, South Korea. Interestingly, almost every other country that did relatively well in quickly getting people tested and shots in arms had a program where the government controlled the insurance and the ability for people to get tested, for people to get vaccinations, et cetera. So we saw how those countries did far better coming into COVID and out of COVID than the United States did. So those are some of the countries we look at.
Okay. Fighting for health equity and universal access to health care are tremendously important to me and many of my constituents at home in Hawaii. Congresswoman, you've been leading the charge to increase access to high-quality, accessible care and reimagining what healthcare in our country can look like. Matter of fact, the first time we met, before I was even sworn into Congress, we talked about the need for Medicare for All. And so I'd love for you to share again in your words,
Yeah.
and you kind of did already, but why our country needs Medicare for all, and how do we get there?
Right. So I start with the vision. You get sick, you get care. Before you get sick, you get care. So you don't get sick. If you need mental health care, you get care. If you need reproductive care, you get care. All of the things that you need to keep you healthy, you get, and you don't have to make trade-offs between whether I pay my rent or get my cancer treatment. You don't have to have grandma sitting at the kitchen table cutting her prescription drugs because she can't afford to fulfill the prescriptions because drug prices are so high in the United States, unlike any other country. You don't have people driving to Canada to buy their insulin because insulin is 10 times cheaper in Canada than it is in the United States. So that's the vision, is we are healthy, we prevent illness, and when we get ill, we actually are able to treat that illness without making these giant trade-offs. What Medicare for All does is we just use the same system of delivery, the same doctors, the same hospitals, et cetera, but we have the government provide the insurance. And that insurance stays with you, Kai, no matter what you do. You change jobs, you have to take care of a loved one who's sick and you have to leave your job, you get health care. That care is comprehensive. It covers all of the things I mentioned. It is deductible free, so no copays, no deductibles, and no private insurance premiums. So your out-of-pocket cost goes way down. It becomes affordable for everyone, but also because the government is providing it, we can also control and negotiate costs much better and bring down the overall costs of the healthcare system. And at the end of the day, you have a system where people can get the healthcare they need when they need it. And I actually think when you look at the cost estimates, we just look at what is spent on healthcare, and we know that Medicare for All would save the country trillions of dollars over the next several decades. The issue that I don't think we even account for is what happens when people get the care they need before they get sick.
Right.
How much would we bring down illness and death and suffering in this country because people actually have the care they need when they need it?
One of the things I hear often is Medicare for All is going to cost too much money. It's going to bankrupt the nation.
Right.
What would you answer to the people that say that?
Yeah, it's just not true. So all of the estimates show that you actually would save trillions of dollars over a 10-year period. And the reason is because the costs of healthcare are rising dramatically. It's just about who's paying it. Right now, individuals across the United States are paying it. Your constituents and my constituents are paying it. And they're paying it sometimes by mortgaging their homes.
Sure.
Or they're paying it by delaying care until it's too late. And then mom dies of cancer because she never got the treatment.
Right.
And so we are paying for this right now. The overall cost of a Medicare for All system is far less than our private insurance costs that we pay today. But yes, there would be a shift in that the government would pay for that insurance. But we know that actually you can include employer taxes. Many employers, particularly small and medium-sized businesses, have said to me, you know, I don't agree with you on a lot of other things, but can you get this done? Because we are not competitive as businesses when we are having to pay for health care for our employees, and other people in other countries are not. So there are ways to raise dollars, but ultimately the cost of Medicare for All is far less than a private for-profit system where you pay a lot, but you get nothing.
Okay. Well, you know, as a veteran, my family and I have chosen to, and I've told you this before, use the military government healthcare program, TRICARE, which includes prescription drug coverage.
That's right.
We're going to talk about that. And the fundamental issue in our civilian healthcare of putting profit before people is clear in the struggle to ensure access to affordable prescription drugs. How would Medicare for All address predatory drug pricing?
Yes, well, in the Medicare for All bill, we have a provision that is a carrot and a stick. So it says that if drug companies won't provide their drugs at a certain cost, then negotiate the cost of those prescription drugs, then we would actually be able to control the licensing of those drugs. And so this is it's a carrot and a stick approach, but at the core, we're working right now to control prescription drugs. If we just gave the ability to negotiate drug prices across all payers. So that's the Affordable Care Act, that's Medicare for All, or that's the Medicare system, and I think individual consumers. Then we would be able to set drug prices at the median level of all OECD countries, and we would bring drug prices down substantially so that no American pays more for their prescription drugs than in any other country. So that's built into the Medicare for All bill. And of course, last Congress, before you got to Congress, we passed a bill called H.R. 3 that was the prescription drug pricing bill. And again, we would save enormous amounts of money by just allowing Medicare to negotiate prescription drug pricing. We're the largest buyer of prescription drugs, and we don't negotiate the prices for Medicare. So you're on the TRICARE system.
But we do
TRICARE
negotiate
does.
prescription drugs for TRICARE.
That's right. So you
just
pay
think
a
about
lot
that.
less.
The military, government-run TRICARE healthcare system that provides healthcare to, thousands of military families and service members across the world, negotiates prescription drug prices, but not Medicare.
Exactly.
Why is that?
The prescription drug companies have a lot of lobbying power, and you and I both don't take corporate PAC money, but the prescription drug companies flood the halls of Congress with money, and they flood the airwaves with ads that scare people into thinking somehow they're going to get higher drug prices, and they have had a lock on Congress. They have managed to stop the government from being able to negotiate drug prices for Medicare in the same way that we do for the VA or for TRICARE.
That's, we need to fix that.
Yes, and we're going to.
That. Clearly, Medicare for All is the goal with universal access to comprehensive benefits. And as we continue to fight for Medicare for All, would you highlight for our audience, short for Medicare for All, progressives in Congress are promoting to expand and access to health care and improve the services offered in the Medicare system. Can you just expand on that?
Yeah, so we know that Medicare for All is a fight that we're going to have to make every day, and it's going to take us some time to get it. I'll be honest, I wish it were happening tomorrow, but we've got to build a legislative history. We've got to actually have the hearings in Congress. We did that for the first time last year, and we're going to do that again. But in the meantime, we have an opportunity right now, Kai, to actually deliver enormous benefits, cover more people, and control prescription drug pricing. So in the American Families Plan, we are pushing to include Medicare expansion. What do we mean by Medicare expansion? 3 things. 1, control the cost of prescription drugs by allowing Medicare to negotiate. That brings in enormous savings. Use those savings to lower the age of eligibility for Medicare. We would love to see at least 60. To lower the age to at least 60 or 62 at least, to be able to include 23 million more Americans into that Medicare coverage. And third, how crazy is it that Medicare does not currently include dental, vision, and hearing? You have to buy a separate private insurance plan if you want to cover dental, vision, and hearing. And as you age, those are the things you need the most. So let's cover dental, vision, and hearing for all of the people that are on Medicare. Our seniors are most vulnerable, and we will provide enormous benefit to those seniors.
So just to clarify, I have a job. I'm 55, 60 years old, and when I reach 65, even if I continue working, if I continue working, I'll continue to have my employer-sponsored health care plan. But if I was retired, I would convert to Medicare at age 65.
That's right.
Everyone in the country that hits 65 gets Medicare.
Exactly.
Basic Medicare.
Exactly.
And then you
even
can
if you
pay
were
for
working,
those supplements.
Even if you were working, if you didn't have health insurance, which most people who are working don't, or you had insufficient health insurance, you could actually use both. You could use Medicare, and you could use whatever insurance you have.
Got it. Okay. And then you can buy supplements on top of Medicare. I think it's Part D, or some additional subsidies, or not subsidies, but additional
government care.
Government care that you could get to boost that up. Okay. Well, I want to touch on this for a second, because you talked about coming from family coming from India, and we both come from diverse districts and represent communities that are too often excluded from the halls of power. Although the Affordable Care Act made health care more accessible for Americans in Hawaii and Washington state because of Medicaid expansion, ensuring that all Americans, even those with pre-existing conditions, we see that there is much work that needs to be done. As we work to overcome the unique challenges in our states, how will Medicare for All address inequities in health and health care for historically marginalized communities, especially indigenous communities across the country?
Yes, this is part and parcel of why it's so near and dear to my heart, and COVID showed it. What happened during COVID? It was Black, brown, indigenous, poor communities that did not get what they needed, were the first to be affected, were the first on the front lines, had the most disproportionate deaths and illness, and it was heartbreaking. And we cannot disassociate that result from our for-profit healthcare system. The fact is that people did not get the care they needed, so they had all these conditions, many conditions, that were never treated.
Yeah.
And they were also in districts that are most environmentally polluted. So asthma, some of the bronchial issues that people have in those areas, poor communities where you get toxic dumps dumped and things like that, by highways where you're breathing all that pollution. Those were the people that were most affected by the virus. The virus goes straight to those places of weakness in health. And so it is not a surprise that that's what happened. And I think we have to recognize that it's because of lack of access to health care that so many Black, brown, and indigenous communities died and got ill. And so Medicare for All would cover everybody. And you wouldn't even have to do anything. You would go to the hospital and you would be covered. You wouldn't have to worry about whether one place is in network or out of network and then suddenly be saddled with debt because you suddenly went to see a doctor that wasn't covered. But also, you know, look, I'm glad we did the Affordable Care Act. It expanded health care for a lot of people. But I don't know if you saw the statistics about medical debt in this country that just came out recently. It is a phenomenal number, more than any other kind of debt in this country.
Wow.
And what is not noticed is that the vast majority of that debt is held by people who have health insurance.
Wow.
But because we don't control these out-of-pocket costs, people end up paying, even if you've got health insurance. GoFundMe became the best health insurance program for a lot of people.
Right.
It was not meant to be, but people needed help to fund their cancer treatment, their insulin treatments. That just cannot be the way it is, and it is poor people, Black, brown, indigenous people that suffer the most.
I mean, I know exactly what you're talking about. A friend of mine had a very, very serious accident last year, and they did exactly that. They did a GoFundMe account and raised about $150,000 to provide for this you know, really important specialized care to help that family member recover.
That's right. And small businesses too, you know, we have a lot of minority-owned businesses, and I hear from all small businesses, even some medium-sized businesses, where people say, you know, I'm paying through the nose for health care. And then my employee comes to me and says, I have this illness and it's not covered. Can you help me? And so they're paying now for GoFundMe. I mean, these are good high road employers who want to do the right thing, but they're just pleading with us in Congress to recognize that they can't take care of everybody's health care with the rising costs that are only fueling the private. The only people that benefit from the system we have right now are the private insurance companies, the private pharma companies, drug companies that are making enormous profits. Their CEOs are making enormous salaries and profits, while the rest of us can't get the care we need.
You know, Medicare for All and that whole national conversation started at least, you know, that I'm aware of a few years back, and it was almost taboo, I guess, to talk about it. But today it's something that we discuss regularly through the Congress and is part of a national conversation on healthcare and where we want to go.
Yes, and I feel very proud about that. You know, when I came into Congress 4 years ago, 4.5 years ago, the bill that was on the table was a very good bill, but it was just a resolution. There had actually never been a Medicare for All bill. Prior to when we introduced it in the House, Of course, Bernie Sanders had a bill in the Senate that he introduced, but in the House, there had never been a Medicare for All bill until I introduced it in the last Congress. And in the last Congress, I had to work really hard to get co-sponsors. I think a lot of your constituents may not know that you don't just introduce a bill and everybody jumps on it. There are hundreds of bills every day that are introduced. You have to really do the work to get your co-sponsors. But we were able to, by the end of last Congress, get almost over half of the Democratic caucus on board. And we were able to get multiple hearings. This Congress, we started with over half of the Democratic caucus as original co-sponsors, including 15 committee chairs. And we have hearings already that we're going to continue. So we are making headway on this, and people just have to have hope and faith, but do the organizing on the ground. And then, of course, support members of Congress like you that are bold and willing to talk about it and willing to explain why we have to move to a Medicare for All system.
Well, I really, really appreciate, you taking the time to come on our show. I think this conversation of providing, universal health care for every American in our country is really, really important. I know in Hawaii, Native Hawaiians and Pacific Islanders suffered disproportionately through COVID-19 because of, in many cases, the lack of health insurance. And that's been really, really difficult to get through. Any final comments or thoughts, even a message you would like to provide to our people in Hawaii or your constituents in Washington State, and why this is so important in this Congress? And as we look to the next month and maybe the American Families Plan and the budget reconciliation, why it's really important that we get these Medicare expansion provisions into that bill.
Well, I would say it's just really important to continue to ask the questions and answer the questions about why it is that the richest country in the world cannot provide health care for its own people. And there's one answer to that, and it's the lobby that's stopping it. So get educated about it. Call your members of Congress, of course, support the ones that already do, but your senators as well. And then talk to the people in your communities. There's been a great grassroots movement of city councils passing Medicare for All resolutions around the country, including in the South and Republican areas. So keep doing that work, keep organizing, and then I would just say to your constituents, make sure that you get elected every year, because we need you back. And we need to just continue to expand the number of people in Congress who feel as passionately about this as you and I do.
Well, mahalo, Congresswoman Jayapal, for taking the time to talk story with me and the people of Hawaii on these important issues. We've done great work for the American people in the 117th Congress. We're going to continue to work hard for them in this Congress, and I look forward to continuing to build upon our progressive priorities together. And if you're interested in following our offices for legislative updates, please subscribe to our e-newsletters on kahele.house.gov and jayapal.house.gov. You can also follow us on social media, and I hope you'll continue to tune in for future episodes of Conversations with Kai. Mahalo.
Thank
you
you.
so much.
Thank
Aloha.
you. Aloha.